Good morning, my YouTube viewers. It is Palestine here. I just wanted to make another video for you because in this video I was thinking to myself, well, is there a link between endometrial cancer and breast cancer? And so I looked it up on Google because I'm not medically trained, and Google just said that they are linked because of hormones, age, and obesity. So basically, if you've got breast cancer, you can also get endometrial cancer because they're linked with hormones, age, and obesity. And if you've got endometrial cancer, you can also get breast cancer. There's a higher likelihood because those are the three commonalities that those types of cancer have in common. And the reason why I had that question is because when someone has breast cancer, quite often they go see a gynecologist. So the breast and the reproductive organs are linked. And that's why you see a gynecologist for your female reproductive organs. But the reason why I asked this question is because, like, maybe around close to 15 years ago, I had a problem with bleeding, and the bleeding wouldn't go away. And one thing that they did was they prescribed me progesterone to stop the bleeding, because during a woman's monthly cycle, part of the cycle she produces estrogen, and then part of the cycle she produces progesterone, and the progesterone stops the bleeding. So basically, because I was bleeding so heavily, and sometimes it would happen at work as well, because I was bleeding so heavily, they prescribed me progesterone, which I didn't really want to take. And, because my sister is saying that I got cancer because I wasn't watching my weight. Well, I would like to say that I wasn't overweight when I had this problem, so it wasn't related to my weight. And but basically they decided to go ahead, and even though they prescribed me progesterone as a short-term measure, they decided to go ahead and scrape out the endometrium and to remove the fibroids that were inside of the uterus. And I believe that there were 3 fibroids, I believe. And I think they took 2 and left 1 in, but because I still kept having lots of pain and problems and things like that, even after they scraped the endometrium and removed the fibroids, because basically every month I would be in excruciating pain, and they just prescribed me narcotics to take for the pain, which I didn't think was a very good solution to the problem. And I couldn't take the narcotics because they made me sleepy and nauseous. And one time I actually was on my way to the bus stop to go to work, and I vomited, but I went ahead and went into work. I always told myself that if I vomited, I wasn't going to go to work, but I went into work even though I had vomited after taking this narcotic that I had been given for the pain. And so basically, what happened was because I kept having problems even after they removed the endometrium, they did another ultrasound, and they said that the fibroids had come back. So even though they had initially removed the fibroids had grown right back. And so, and that got me thinking. Just got me thinking. And then, like, both of my grandmothers had hysterectomies. I know one of the grandmothers, she told me it was because of the bleeding, but I don't know about the other grandmother. My mother's had a hysterectomy. She didn't tell me what it was about, but I think it was about the bleeding. And my sister had a hysterectomy. And whenever they biopsied, the uterus, which is what they do whenever they remove something. They said that she had carcinoma. I'm not sure if she knew what carcinoma was, but the thing is that the treatment for uterine cancer is a hysterectomy. So they gave her the hysterectomy and then they biopsied it and found out she had carcinoma. But in my situation, because I was in another country, and so basically they just removed the endometrium and the fibroids and they threw it all in the trash. And the reason why is because they say that fibroids are very rarely cancerous. And since fibroids are very rarely cancerous, they didn't autopsy it. But who knows? I could have had cancer because they didn't biopsy it. And since they didn't biopsy it, we never will know if I had cancer or not. But I do know that my sister had cancer, but the treatment was a hysterectomy, so she didn't go back for any other treatment. And I'm not sure if she even knew what they were talking about when they told her she had carcinoma, but I knew what they were talking about. And so I had this one gynecological problem where they removed the fibroids and the endometrium, but the fibroids came back. And then I got breast cancer. So basically these two cancers are linked because of age, weight, and hormones. They're not. And so I just thought, oh, well, I'd like to go ahead and make a video about that, to talk about these two types of cancer, that because they're indirectly related. So if you get one type of cancer, you can get the other type of cancer as well, because they're both hormone generated, age generated, and weight generated. And so that's just what I wanted to speak about in this video. So I could have had uterine cancer and not known it, because they never biopsied what they took out of me. And then I got breast cancer as well 15 years later. So we never will know, will we? But it's just something to think about. So I think this is going to conclude my video. If you like my video, please like and subscribe, and I'll be making other cancer related videos for you in the future.